coronavirus situation on Merseyside is such that I accept that something serious needs to be done. Yesterday in Aintree and the Royal Hospitals, 279 coronavirus positive patients, the highest number in any English hospital. Substantial and widespread community transmission, 600 cases per 100,000, and not just in student areas. A high incidence, and this is the worrying thing, of spread to vulnerable groups, particularly people over 65 years old, 31 in critical care. So something definitely needs to be done. But I do worry that the way in which the government has handled the pandemic so far and its manifestations and what impact this has had on the current situation in the northwest isn't helping. There's widespread feeling that lockdown in the Liverpool City region was lifted before cases had fallen far enough. The failings and increasingly poor performance of the nationally arranged test and trace system are making controlling the virus much harder. People are waiting many days to get results. Very many contacts of those testing positive are going untraced until it's too late for isolation to make a big difference. The lack of discussion, candour, until recently even engagement with local leaders, mayors and MPs means that there is a trust issue, which was worsened by yesterday's events, at which the CMO suggested that these Tier 3 measures, which the Prime Minister had told the House would stop the epidemic growing. He said he had a high confidence that the base measures in it would not stop the epidemic growing. And then even later, we heard as my honourable friend from the front bench said, the Sage Minutes suggesting widespread scientific advice not being followed 3 weeks ago in September. So we do need, and I urge the Minister, to have more transparency, more openness from government. We don't have enough of it. Let's have the information in real time and let's work on it together. But most of all, Madam Deputy Speaker, we need proper financial support for the people on Merseyside affected by these very serious restrictions. Tier 3 measures are going to devastate some of our lowest paid workers. We can't defeat the virus on the cheap, and we shouldn't do it on the basis of the living standards of the poorest. The level of assistance proposed so far is inadequate to the task. There are 41,000 people, according to the TUC, in the City region area who might benefit from the local furlough scheme. But there are many, many thousands more whose businesses will not be forced to close, but who will not benefit by one penny from these proposals and from the support. It is not enough. More is going to have to be done to support local people in Tier 3 areas and to prevent penury following on from the pandemic.